All right, Officer Store. We're here talking GTAKs. This is Rob. I'm Jerry. Rob, what qualifications do you have to talk about anything medical?
That's a good question, Jerry. So I'm the product specialist here at the Officer Store. I take care of all the EMS supplies. I'm a stop the bleed instructor. I'm an EMT that has 18 years experience, prior military. I've been around the block a couple times. So
He knows a thing or two. So the GTAK, the Gunshot Trauma Aid Kit, is one of the many trauma kits we have on offer at Officer Store. We're going to take you through, break down each one, starting with the basic. Rob, can you tell me what's in the basic kit and why it's there?
Okay, basic kit, exactly what it said. It's basic. It's the bare minimum you need to stop the bleed in case of any type of gunshot, but it's not just gunshot. It can stop lacerations, stabbing, punctures, any type of massive bleed that you have in the body. Inside, you have a pair of trauma shears to expose the wound. You have an Israeli dressing, a chest seal, quick clot gauze, and a SWAT T tourniquet. It's in a nice compact package, so it'll fit in your cargo pocket, so you can keep it on you at all times. Most officers like to just carry a tourniquet on themselves, but that only stops extremity bleeding, Jerry. A tourniquet's not going to stop a neck bleed or laceration in the head or in the chest. You're going to need other gauze. That's why we made these GTAKs specifically for law enforcement.
Excellent. Now, what would you say is the most important item in the GTAK basic?
It's kind of a tie. It depends on where you're bleeding from. If it's an extremity, the SWAT T tourniquet is going to be the most valuable item in there. If it's a thoracic injury, you're going to want the Israeli dressing to stop the bleeding.
Now, SWAT T is nice because you can use it as kind of a pressure bandage too, right?
That's correct. It's also great, not only as a pressure bandage, it's also good on pediatric patients who have smaller limbs that a normal tourniquet wouldn't fit around, and also your canine.
Excellent. Let's check out the intermediate. I'm gonna break this guy open. Is there anything special about these bags?
They're waterproof, they're easy to reseal, so if you need to restock, instead of having to try to tear and fiddle around with the foils that most of these packs come in, ours is a little Ziploc bag that anybody can rip open and get the components.
All right, I've spilled the components everywhere, very messily. What do we have in here?
So we have another pair of shears to cut through just about anything to access the wound. We have the soft T tourniquet that is a great and one of my favorite tourniquets because not only is it really easy to apply to yourself, it comes apart to be able to assist helping someone else. It's easier to slide this on a wound on someone who's laying down when you can have it open, snap it together, take up the slack, and then tighten it down. In here we have combat gauze, which is a good wound packing with a clotting agent. We also have a chest seal that come in a pair because one is not enough if you have a through and through injury. So if you have an injury through your chest and your side, you want to get both sides of that injury closed off. And then lastly, we have the bag itself that's easy to open and access all the components you have.
Last but not least, we've got our advanced GTAK, my personal favorite. Rob, break it down.
Okay, this is the most advanced kit that we have. It has some components in here that maybe you're not going to use, but there's someone on scene that can use them. So the big difference between this and intermediate is the decompression needle. And that is for your collapsed lungs or tension pneumothorax. And obviously you're probably not going to be stabbing yourself with a needle, but when paramedics arrive on scene and they see that you have a trauma kit, they're just like in the military where every soldier would have a trauma kit on them, every officer should have a trauma kit on them. And this would allow the medic to take out the needle and find the intercostal and insert the needle and address either a tension pneumothorax or a collapsed lung that you may have from penetrating trauma. It also has quick clot gauze. It has a North American Rescue tourniquet, 4-inch Israeli bandage, It also helps trauma shears and the nasal airway. The same thing, the nasal airway would be most beneficial for someone else that if you happen to be unconscious, they can protect your airway so you don't suffocate.
Guys, if you have more questions, put them in the comments, and I'll email them to Rob and bother him so that he answers it.